There are 4 generations of cephalosporin. I'm going to give you a pattern to help you remember which ones are which. It's going to be nice and simple for you. Now, these are also beta-lactam drugs, and they also inhibit cell wall synthesis, okay? But they are less susceptible to penicillinase. That means they cannot be inactivated as easily as the other drugs we talked about. Well, look at the side effects. Well, there's hypersensitivity reaction. I don't care about that. But the next one on the list is very important. It can cause a vitamin K deficiency. And remember, vitamin K is important for clotting factors 10, 9, 7, 2, protein C and S. Vitamin K deficiency, okay, vitamin K is important for clotting factors. Clotting factor 10, 9, 7, 2, protein C, protein S. And remember that anytime you have a clotting factor problem, you bleed into your cavities. If you have a platelet problem, you bleed from your skin and mucosal surfaces. If you have a clotting factor problem, you bleed into your cavities. Cephalosporins have cross hypersensitivity with penicillins in 5 to 10% of patients. I know 5 to 10% doesn't sound like a lot, but that's a lot of people. I'd like to ask you a little vignette saying that which drug is contraindicated when someone is on this drug. Well, that's how they get it from. Because in 5 to 10% of patients, okay, cephalosporins and penicillins can react and cross hypersensitivity. In that case, hypersensitivity is important. That's why I'm mentioning it. We talked about immunopenicillins earlier. Remember, we said nephrotoxicity gets worse with cephalosporins. Well, here are your cephalosporins. We'll talk about each one specifically in a second. Cephalosporins can also cause disulfiram-like reactions with ethanol. And we'll talk about disulfiram-like reactions when we do our hematology lecture. So look at this, first generation. We use it to treat PEC, Proteus, E. coli, Klebsiella. Mnemonic straight out of the book. See it? So first generation cephalosporins we use to treat PEC. P for Proteus, E, C for E. coli, K for Klebsiella. Understand? So the P stands for Proteus. EC for K for Klebsiella. Well, we can know what it's used for, but if we don't know the name of the drug, it's not going to matter. Well, I don't want to memorize the whole drug, cefazolin and cephalexin. I'm not trying to do that. I'm going to recognize a pattern, I'm going to click, and I'm going to move. You guys can sit there and memorize the whole drug if you want to. I'll be on the next question. Okay? So, Jeremy Lin is a basketball player, drives a Lexus. He's the best basketball player, number 1, I say. Drives a Lexus. Jeremy Lin drives a Lexus. Lin and Lex, first generation. Lin and Lex. Lin and Lex. Lin and Lex and Lin and Lex and Lin and Lex. Excellent. Starts with Ceph, has Lin and Lex in it. First generation. Use it to treat PEC. Second generation. You treat hen pecs. I don't know why you're pecking hens. I don't know what the hell that means, but that's a mnemonic. It works. So we'll leave it. Hen pecs. H for H. influenza. E for Enterobacter. N for Neisseria. P, Proteus. E, C, E. coli. K, Klebsiella. S, Serratia. There's only 4 things that are different between first and second generation. Makes sense. 2 comes later in the alphabet. 2 is a bigger number. This treats more things. Second generation treats more things than first generation. First generation, 1 word. First generation, 1. 1 word mnemonic, PEG. Second generation, 2 words. Hen pegs. Got it? 4 things that are different. H. influenza, Enterobacter, Neisseria, and Serratia. We're going to review those in a second, so don't worry about it. If you want to make her happy, buy her some fake fox fur. Fake fox fur. See this? Right in the middle. Fake fox fur. Right there in the middle. Fake fox fur. I don't care about the whole damn drug name. I don't care to know it. I'm not going to know it. I'm going to memorize it this way. I'm going to see it on my test. I'm going to click, and I'm going to move. Or else you guys are going to get confused. Which was first generation? Which was second generation? Which was third generation? Which was fourth generation? Doesn't matter. Second generation cephalosporins have 3 sounds. Okay? Before we get to second generation, this should be the first generation. We said first generation cephalosporins have 2 sounds. What 2 sounds? Lin and Lex. Excellent. Second generation, 3 sounds. Fake fox fur. Fake fox fur. Say it. Fake fox fur. Go.
Fake fox.
Say fake fox fur.
Fake fox.
Say fake fox fur.
Fake fox.
That's your second generation. We use it to treat hen pecs. Click and move on the test when you see it. You don't have to sit there and memorize everything. Third generation is too damn easy. The third generation, in the middle, has 3-letter words that start with T. Try, Taz, and Tax. Can't forget it. Even starts with the T to remind you, third generation, there's 3-letter words right in the middle. Try, Taz, and Tax. Try, Tax, and Taz. Try, Tax, and Taz. Let's do it again. Say it together, everybody. Try, Tax, Taz. Try, Taz, Tax. Say it.
Try, Taz, Taz.
Say, oh, it's in order. It's try, tax, Taz. Say it that way. Go, try, tax, Taz.
Try, Taz, Taz.
Try, tax, Taz. Say it again. Try, tax, Taz. Say it again. Excellent. We use these for severe gram-negative infections. Okay? Now, meningitis, And gonorrhea, we use ceftriaxone. So try. What do you use for meningitis and gonorrhea? Try. Which one? Try. Which one's best for Pseudomonas? It's Taz. Which one's best for Pseudomonas? But for meningitis and gonorrhea? Which one's best for meningitis and gonorrhea? And what about for Pseudomonas? Taz. So let me ask you questions then. First generation, second generation, or third generation? So I'm going to name the sounds of the drugs, and you tell me if these sounds ring a bell. And when they do, you tell me if it's the first generation, second generation, or third generation. Ready? Lynn and Lex. Fake Foxford. Try, Tax, and Taz. What generation? What about fake Foxford? What about Lynn and Lex? What about Taz? What about Tax? What about fake? What about Lynn? What about Fox? Lynn and Lex? Try, Taz, Tax? Fake Foxford? Try, Taz, Tax? Fake Foxford? Lynn and Lex. We go to the first generation, second generation, third generation cephalosporins. Now we're going to do the fourth generation cephalosporins. There's only one fourth generation cephalosporin. Only one fourth generation cephalosporin. The name of that drug is cefepime. What's the name of the drug? Cefepime. Say it again. Cefepime is the only fourth generation cephalosporin we need to talk about. It's used for Pseudomonas and other gram-positive organisms. Severe gram-positive organisms, as well as Pseudomonas. So in AIDS treatment, for AIDS treatment, we give 3 drugs. How many drugs? 3. How many drugs? 3. How many drugs? 3. 3 drugs. 2 of those drugs must be NRTIs. 2 of those drugs must be NRTIs. How many NRTIs? 2. But how many drugs total? 3. So we can give 2 NRTIs and 1 other drug. NRTI stands for nucleoside reverse transcriptase inhibitor. It competitively and reversibly inhibits nucleoside binding to reverse transcriptase. And remember that if it's competitively and reversibly inhibiting something, that means it's a competitive inhibitor, that means it messes with Km. Km goes up. Km goes up. Which means affinity then goes down. So competitive inhibition is when Km goes up and affinity goes down, and affinity is potency. So affinity and potency both go down while Km goes up. In competitive inhibition, it binds to the active site. What site does it bind to? The active site, which means I can add more substrate to overcome the problem. Okay? So now when we look at this drug, these NRTIs, we should keep one thing in mind. All of these NRTIs need to be activated by thymidine kinase. They all need to be activated by thymidine kinase. They all need to be activated by thymidine kinase. Side effect includes bone marrow suppression. That should make sense to you. And that bone marrow suppression can be reversed with G-CSF and EPO. And we talked in our immuno lecture about how GRASSTIM means granulocyte stimulating. G-CSF is granulocyte colony stimulating factor. GRASSTIM or GRAMOSTIM, which is granulocyte and macrophage stimulating factor. And we said GRASSTIM, G for GRASSTIM, G rhymes with B, B rhymes with 3, works on IL-3. This is touching back on that since we've covered it already. So bone marrow suppression, which can be reversed with G-CSF and EPO, okay, as well as peripheral neuropathy, lactic acidosis, and megaloblastic anemia. I want you to keep reviewing those things, and when you're at home, I want you to repeat these out loud as we repeat them out loud here. So let's go over the side effects. Bone marrow suppression, say it. Bone marrow suppression, say it again. Lactic acidosis, say it. Megaloblastic anemia, say it. Peripheral neuropathy, say it. And we can reverse that bone marrow suppression with G-CSF and EPO. We can reverse it with G-CSF. We can reverse it with G-CSF and EPO. Excellent. All the NRTIs have the Dean, Bean, Scene sound. They all have the Dean, Bean, Scene sound. What sound?
Dean, Bean, Scene.
Dean, Bean, Scene. Say it again.
Dean, Bean, Scene.
Except for 2, tenofovir and abacavir. Tenofovir and? Tenofovir and? Tenofovir and? Abacavir and? Tenofovir and? Abacavir and? Tenofovir and? Abacavir and? Tenofovir. Those 2 drugs don't have the Dean, Bean, Scene sound. They don't fit the pattern. The one that starts with the T does not need to be activated by the T. Tenofovir does not need to be activated by thymidine kinase. Tenofovir, the drug that starts with the T, does not need the T to be activated. All the drugs have the Dean, Bean, Scene sound in the NRTI category. Remember, you'll give 3 drugs total. 2 of them will be NRTIs. They all have the Dean, Bean, Scene sound except for tenofovir and abacavir. And the one that starts with the T, tenofovir, does not need to be activated by thymidine kinase. It does not need to be phosphorylated. Which is the NRTI that does not need to be phosphorylated? Which is the only NRTI that does not need thymidine kinase to be activated? Tenofovir. Excellent. Then there's one we should know because this one is used as general prophylaxis. It's used also to decrease vertical transmission risk in pregnant women, and the name of that drug is zidovudine. Zidovudine, say it, zidovudine, go. Say it again. Say it one more time. Zidovudine, okay, is the one that is used as general prophylaxis and to decrease vertical transmission risk. Look, Dean, Bean, seen, I've highlighted them for you. Zidovudine. And then we have didanosine. Say didanosine. Didanosine, say it. And didanosine, they're dying of pain because they have pancreatitis and peripheral neuropathy. They don't really die of pain, I just remember it that way. Okay, didanosine causes peripheral neuropathy, okay, painful neuropathy, sorry, as well as pancreatitis. Didanosine. So there's 3 drugs there that you should know. There's one that does not need to be activated by thymidine kinase. Which one is it? Tenofovir. There's one that's used as general prophylaxis and to decrease vertical transmission risk, and that one is? Zidovudine. There's one that can cause painful neuropathy as well as pancreatitis. The name of that drug is? Didanosine. Didanosine. Now, zidovudine. Zidovudine used to be known as AZT. That drug can cause megaloblastic anemia. Which one on this list can cause megaloblastic anemia? Zidovudine. Which one? Which one? Excellent. So all the NRTIs have the Dean, Bean, Seen sound. They competitively inhibit the nucleoside binding to reverse transcriptase. They all have the Dean, Bean, Seen sound. They all need to be activated by thymidine kinase. They all have the Dean, Bean, Seen sound except for tenofovir and abacavir, and the one that starts with the T does not need to be activated by T. Then we have protease inhibitors. Protease inhibitors, and you never tease a protease. Say you never tease a protease. You never tease a protease. Say it.
You never tease a protease.
All the protease inhibitors have the Navir sound. N-A-V-I-R. They inhibit the pol gene. P for protease, P for pol gene, P for prevents maturation. They inhibit protease. Side effects, hyperglycemia. Say it.
Hyperglycemia.
GI intolerance. Say it.
GI intolerance.
Lipodystrophy. Say it.
Lipodystrophy.
So protease inhibitors that cause hyperglycemia, GI intolerance, and lipodystrophy. All the protease inhibitors have the Navir sound. What sound do they have?
Navir.
What sound do they all have?
Navir.
So I don't care about everything else. I just want to know the first letter. I don't care about the middle. There's one that can cause crystallization in your urine. There's one that can cause liver failure. Alphabetical order. Crystallization in your urine, and there's one that can cause liver failure. I comes before R. Crystallization comes before liver. So I, Navir, causes crystallization. R, Navir, causes liver failure. Which one causes crystallization in your urine? I, Navir. Which one causes crystallization in your urine? Which one causes liver failure? I know I, Navir, R, Navir. I'm done. I'm not worrying about all this different stuff. I'm not going to memorize every single drug. I know it ends in Navir. I know the one that starts in I causes crystallization. The one that starts in R causes liver failure. I gave you a gap between NRTI and NNRTI. Let me ask you a question. Let's say you give somebody a protease inhibitor. How many are you going to give them? How many protease inhibitors are you going to give them? 1. But the other 2 drugs you're going to give them are going to be? NRTI. The difference between NRTI and NRTI is one N, right? And that N means non. So non-nucleoside reverse transcriptase inhibitor. How many NRTIs are you going to give somebody?
1.
How many?
1.
1. And they work the same way. They just bind to a different site. That's all they do. They're non-nucleoside reverse transcriptase inhibitors. Side effect profile is the same as NRTIs, except NRTIs are associated also with rashes. And NRTIs are also associated with rashes. Non-nucleoside reverse transcriptase inhibitors do not need to be activated by thymidine kinase. So N for non, N for no, does not need to be activated by thymidine kinase. All the NRTIs do. So look at the NRTIs. They all have Vir in the middle. They have Vir in the middle. They have Vir in the middle. What do they have?
Vir.
Where's the Vir?
In the middle.
They all have what?
Vir.
Say Vir in the middle. They all have what?
Vir in the middle.
They all have Vir in the middle. Not Vir at the end. They all have Vir in the middle. Where's the Vir?
In the middle.
In the middle. Now let's review. All the NRTIs have what sound? Dean, Bean, Seen. What sound?
Dean, Bean,
Except for tenofovir and abacavir. Which 2 do not have the Dean, Bean, Seen sound? Tenofovir and abacavir. Which one does not need to be activated by thymidine kinase? Tenofovir. And all the protease inhibitors have what sound? Navir. All the protease inhibitors have what sound? Navir. And there's 2 that we talked about. One can cause crystallization. That's I, Navir. And the one causes liver failure is R, Navir. Which one causes liver failure? R, Navir. Which one causes crystallization? I, Navir. Alphabetical order, right? I before R, crystallization before liver. And all the NRTIs have Vir in the middle. All the NNRTIs have what? Vir in the middle, not at the end. And that'll be important when we get to this drug. Integrase inhibitor, raltegravir. Where's the Vir here? It's at the end. You see it? Where's Vir in the integrase inhibitor? At the end. Where's the vir? Don't confuse raltegravir with tenofovir or abacavir. That's why I made you say it 10 times. Because raltegravir, tenofovir, and abacavir all have vir at the end. But tenofovir and abacavir are NRTIs. Raltegravir is an integrase inhibitor. Integrase inhibitor, well, it inhibits HIV genome integration into the host cell. Side effect of this is hypercholesterolemia. What's the side effect of raltegravir? Excellent, hypercholesterolemia. Those are AIDS drugs. That's all you need to know, and that brings us to the end of our microbiology lecture.